key, so then I'll say good morning again. Good morning, everybody. Welcome to the PATH onboarding session. I'm Suzanne Wagner from Housing Innovations, and with me today who put together this session are Brenda Earl from the Department of Mental Health and Addiction Services, Lauren Preddy from Housing Innovations, and Shannon Quinn Sheeran. So welcome. We'll tell you a little bit more about us in a minute. Advance the slide. Sorry, for some reason. Oh, there we go. There we go. Talk a little bit about what our goals are for this session as we welcome you. We're so glad you could be here. As the slide advanced, colleagues? Yes, okay. We know everyone's busy, so that's where we want to start. And that's actually really relevant to what we were just talking about, that everybody's got a lot going on, that this outreach work is really complicated and folks have lots of needs. And you guys are, dealing with a lot with not only COVID, but everything else that unsheltered folks present. So really our goals are to provide, information that gets people excited about outreach and understand their roles and what the great work is all about, for people to see themselves as part of a larger system. I think a lot of people on this call recognize your names. I know Connecticut is really a leader in the country in organizing on a statewide basis, and you are part of a statewide, initiative, which is great, that has consistency and similar goals and values, and we'll talk more about that. And then also to share resources. There are a billion slides here. I don't think actually a billion, 83, 85. We can't possibly get through 85 in 2 hours. So some are for reference. There's actually a lot of reference at the back. And we'll be really wanting to cover everything from the beginning to end. So if we skip something that you're interested in or you wanted us to elaborate on, don't wait for us to pause. Just raise your hand. I think people know how to do that. Type in the chat box if you have a comment or a question. Use the emojis. However you want to reach out to us, do it. Or just unmute yourself and talk. I just had that happen last week in a training where I was talking and somebody unmuted and started talking, and that's fine too. We're all here working together really to end homelessness for unsheltered people in the state of Connecticut. Just a reminder also that there's a follow-up. So some things you may be interested in hearing about may be scheduled for the supervisor session, which is currently scheduled for March 17th. So we are still, even though we have so much information today to share with you, not covering everything. There's more, and that'll be session 2 on March 17th. And let us know if you need to be connected to that. The session is being recorded. You will know that because Zoom warns you now, and it will be posted to the web. I think some people may have to leave early. That's fine. You can watch the recording. Okay, I see some notes. Sorry, I just was checking the chat box in case there was anything I needed to attend to, and I think we're all good. And I just want to say, in terms of our background on outreach, I think Lauren, Shannon, and Shannon, I think many of you know them from the monitoring and the PATH support, the training that Housing Innovations has been doing for a long time. We've been involved in outreach work, street outreach work, since before some of you were born. I know that. In the 80s, late 80s and early 90s in New York, we worked at CUCS, which had street outreach team, and have continued to work with outreach. We reorganized street outreach in New York City, and we were a part of those efforts. And just recently did work on the standards for the state of Connecticut. And Lauren's authored a white paper that we hope someday will release. But we love this topic and we're really committed to it. And outreach is really so important. And it is such important work because it's usually the most vulnerable people who you're working with, who our systems are really not catching. So we're really here with our hearts and our souls for you guys. Okay, so just to get a little bit, this is good because we don't have such a huge group. Just to get to know each other a little bit, if you can turn your cameras on. I saw some chats from people, they're not camera ready or they're driving. That's fine. Turn on your camera as much as you're comfortable doing. It's not mandatory. But if we just want to get folks to know each other a little bit. Put your agency, your role and your title, your location, like what part of the state you're in. We know everybody's in Connecticut, or maybe not everybody's in Connecticut now that we can do training by Zoom. Maybe some of you are somewhere else. And then your favorite winter activity, which took me a long time to ponder that one. Staying in from the cold is mine. But anyway, put your favorite winter activity, your role, where you are, what part of the state, and maybe your can. That's how you identify. Type that in the chat box. I see more faces coming on. Hi, guys. Welcome, welcome.
Hey, Suzanne, do you think just I could take a quick second to introduce myself while they're putting that in the chat?
Absolutely, Brenda. Sorry, I meant to ask that.
No, that's okay. I just wanted to give a quick minute of history of how this training kind of came about. So I'm Brenda Earl. I'm with Demas. I just want to thank you all. Again, I know how busy you are, especially from requests from me. So I appreciate you guys taking the time to join us today. So this training came about because there's been, I think through COVID, more turnover than normal, I think, especially outreach, because again, it's not just, oh my gosh, COVID, it's, oh my gosh, COVID, now I have to go outside and find the most vulnerable people while dealing with COVID. So I think it's just naturally been something people are hesitant to either take the positions or stay in the positions, and there's just been a lot of turnover. We thought if we could kind of record some onboarding information that you can kind of put that as part of your onboarding for your outreach case managers and your outreach supervisors. And it doesn't just have to be PATH. You'll see a lot of the stuff that you learn, you can share across the board if you have other outreach programs in your agency. So I hope this is helpful. I hope it's a good use of your time. I want to just shout out and thank Housing Innovations. They're always up for some of my crazy ideas and the feedback that you guys give us through monitoring, and they're right on it. I think this is going to be such a helpful training, especially to share with new staff coming on board. So just thank you for being here. We really appreciate it.
Thanks, Brenda. That was really helpful context. And I'm seeing the people coming in the chat with their winter activities. I have some people who are joining me inside watching the cold. Maybe not having a favorite winter activity. That certainly crossed my mind. Having some soup and staying outside. You can read these. Being in the snow with the dogs. Got some cross-country skiers, I think, in there. Quite a bit of, let me just trying to scroll through. Okay, great. Walking in the winter sun, it is pretty. And the pink sunsets, maybe that's the thing I like best. Sledding with the daughter, watching football. Okay, someone's homesick. Sorry about that, Elise. I hope you feel better, but glad you're with us. And then it's not COVID. Cross-country skiing, watching a movie as the snow falls. Hello, Elisa, how you doing? Not fond of winter. I'll give you a thumbs up. Okay, great. So just a little bit of, I think it's always good to start the training with something a little different from what we're talking about. You all just are, I'm sure already it's 10 o'clock in the morning, have covered many miles in your days with your families and with your jobs, and just to take a little bit of break and think of something fun. So the dogs do love the snow. That's a fun thing in the winter. Okay. Great. So what are we going to do today? We're going to do this, as we said, we have a lot of material, but our big goals, really, we welcomed you. We're so happy you can come and make time. We're going to talk about outreach and really what is the statewide concept of outreach, which is something you have in the state of Connecticut, really, which is wonderful, what the values are, the vision and goals, and what some of the outreach measures are. And then we'll talk about engagement with people. I mean, that's obviously the heart of the matter. The key to doing the work is engaging relationships with people so that we can work with them towards a housing plan. And in that vein, how does housing integrate with outreach? What's Housing First about? What's housing focused case management? How does that address and how do we structure the work? Then I know everyone's favorite is documentation and administrative responsibilities. We'll cover those for you. And then key partners. As I said, this is really, Connecticut is really innovative, and the state coordinates across lots of different agencies, all of you who are here today, as well as others. And we have kind of a listing of all the different partners as well as their roles. And again, we will be able to drill down so far today with the time we have, and then we'll wrap it up and share the additional resources. So that's what we're planning to cover. I want to just ask Shannon and Lauren if you could keep your eye while I'm presenting on the chat box in case there's something I need to be interrupted by. All righty. And anybody, if there's something you want to, questions or comments, but we are going to give you some, I forgot to mention this, we are going to have some breakouts, and we are going to have some polls. So to also give you a chance to interact, we don't want this to be just us talking to you, but we want you to have a chance to meet each other. And I see the group has gotten much, much larger, so that's terrific. Okay. So we are going to launch some polls so this is something you need to click on, is a Zoom poll, is how long you've been in your current position and how much experience you have in outreach work. And I will launch this. Relaunch the poll. Okay. Yeah. So length of time in your current position is the first question. I think both questions should show up. I don't see what you guys see. So are both questions showing up? Yes. Okay. And then the second question is how much experience you have in street outreach work, because we realize some of you may be new to your positions, but you may have a lot of experience in the field. A couple longer than I can remember is coming in there. Okay, we have about 16 people responding, and I know we're 4, so that's 20. So that's a pretty good, now we're at 17. So that's a pretty good rate. I'm going to give it another 5 seconds. Oh, I think we've got everybody. Yeah. Or maybe it does exclude the hosts because now it says 19 of 22. Okay. I'm going to end the poll and share the results. So how long have you been in your current position? So we actually, as I see this, it looks like about a third or a little bit more, about half of the people are less than 6 months. And about a third of the folks are more than a year, and then a few 20% in between. Okay. So we really have a spread. A couple of folks, 2 people, less than 3 months. So welcome, welcome. Hopefully you're excited to be in this role. And then in terms of how much experience people have in street outreach work over the course of their careers, about half the folks are pretty new in this last year. But about 15% longer than I could remember. And then we have a spread between 1 and 3, 3 and 5 years. So we have some people who've been around. So and some people are new. So we, again, I'm gonna stop sharing this poll, but I'm so happy to see that there are folks here who are really committed and have been working in the field for a long time. And, you know, outreach work is really a lot of art. You know, I think what we're going to try and do today is bring a lot of science and what's the science of outreach and what are the goals, but it is also very artful work. And I know that people who've been in the field, I'm sure, have wonderful examples and stories to share of how they've done things. We're going to talk a little bit about what the value, visions, and goals are. A lot of this has really been recently codified in a new document that's going to be a resource for all of your programs. So if this doesn't look familiar, it shouldn't, because it isn't out yet, but it's in the oven. Some of you, I think, participated in a meeting to give feedback on this document and the standards. But this is really DEMIS and DOH coming together and saying, here's what we expect street outreach programs to be doing. Here's the values and vision, and then here are the expectations. So hopefully to be released around March, so a little bit of a late winter, early spring release. And in this important context, because you are working within a statewide system, as I said, and hopefully this will be a great resource for folks. I'm not going to read all these. I know a lot of you come to the training, so people read slides from beginning to end to you, but we're not doing that today. I'll get a smile from 1 or 2 of you. You'll get my sense of humor. I do see that. But I will highlight some of the major points about the values. And I think these are values you probably all share, but it's great to have them written down. that this is a housing first approach. That street outreach work is, while we are providing comfort to people, we're engaging relationships. We are working to get people into a better place to live, from unsheltered to housed. So it's housing first, and it's urgent. We want to get people out of homelessness as quickly as possible, respecting their choices, hearing where they're coming from, respecting their property as well. As we've mentioned already 5 times in 20 minutes, it's about relationships with the clients and then also relationships with partners. And we have some more discussion of that later about how to do that, but that's the heart of the matter. We also trying to help people minimize their risk and reduce their harm. Living outside is dangerous. Some of the habits folks have are dangerous. So we're also helping to keep them safe. And we're going to talk about safety today, helping to get equal access for different people. Being consistent. And that's really where the standards come in, I think, in really setting up some standards across the state. Working with clients as an ally, as a partner, not as a top-down kind of a relationship, but really listening to people. Why don't they want to come inside? What has housing been like for them before? What are they needing? What are they wanting? Maybe it's that pet, and that's the most important thing to them in their lives, and they're not going to get housed if they can't get housed without that pet. And instead of trying to talk them out of getting rid of the pet into getting rid of the pet, is really becoming an ally and trying to figure out how that journey can be really come to life for people. Be part of a network, but also take care of ourselves. This work is difficult. Folks have a lot of needs. We're seeing people, as we'll talk about, have been through traumas. They may be getting traumatized while we're working with them. It is tough work. People have lots of experiences. So make sure taking care of yourself is a part of your organization and your program. Of course, we're meeting people where they're at, and we're helping them move forward from there in a creative way. This is creative work. As I said, we have science, we have evidence-based practices, but it is also a really art. What engages one person may not be the same thing that engages somebody else. So we have to be creative in this work. I know, again, everybody's favorite, but it's really important to get with the data, the documentation. Connecticut is really trying to have an integrated system where we know who's unsheltered in the HMIS. And I know a lot about people's duplicate data entry challenges and some of the time constraints, and a lot of work is going into making it easier for you to get your data in through work that Nutmeg's doing to streamline and centralize that. Because Connecticut really uses data and really looks at it and really thinks about, what does that tell us about people? What does that tell us about what we're doing? So I know, again, you guys are busy, but really getting that data in and then doing planning, really keeping up with the plans. And we'll talk about the outreach plan now. We'll also talk about the outreach plan at the supervisor session in more detail. We'll keep referencing it, but really every team should have a plan. Where are we going? When are we going there? Who's going when? What are our hours? How do we keep safe? Who are our partners? How often do we check in? When is our by name list meeting, et cetera, et cetera. So we want to really have a plan for what we're doing. Anything in the chat I need to pay attention to or should read out? Okay, great. So just what are the goals though? That's a lot. That vision is really beautiful. It's big. And I think it's hard to disagree with any of that, but what is our work? And this is 6 goals, and that's a lot of work, is getting people safely connected to housing, to income and other supports. And, people need money, even though we can get them a voucher and they may have 0 income, and we definitely don't want income to be a barrier, but we want to focus on housing and helping people get more money. We'll talk more about that, and connecting people up with supports, friends and family, their network of care. Part of the goals is finding people, making sure we are reaching everyone in the geographic area we're serving, trying to not lose people between the cracks and reduce gaps in services and connect better from one service to another, be strategic about the use of resources, and then help people really meet their tenancy obligations. We're going to talk a little bit about that today. There's lots of other trainings that we're going to reference that can help you do this work and achieve these goals. But really thinking about the role of tenant and working with people to assume that role and be good in that role. And then how the handoff works when people are in aftercare and what the expectations are. There are goals around making sure that the connections are sticking and providing a good warm handoff from your service to the next service and checking in on folks to make sure things are going okay. Because sometimes it doesn't work out. You know, getting housing is great, but it may not be a fit. There may be issues. They may need new connections. Okay, so just quickly on the numbers, is getting people into housing. That's a key measure. And there's a few, I'm not going to read all of these, but there are sub-measures under each of these big outcomes. But moving people into housing is the most important thing to, you know, in the outcomes to really focus on is, are people moving in? Are they exiting to permanent housing? And are they on a prioritization list? That people, episodes of homelessness are as brief as possible. So there are measures there related to getting things done in a timely way and making it more quickly for people to connect into and move into housing. That people are getting support using a harm reduction approach and getting tenancy preparation. So we're looking there at income and documentation of resources and services. And then again, minimizing gaps and duplication, and then supporting people to adjust to their new surroundings. So are we showing check-ins for 90 days after they move into housing? So these are things we'll pick up again, I think, in the supervisor session, although that is not completely designed yet. But certainly it is a really big and important part of the work. And I know it's a lot of work that you're doing. Again, we want to reinforce that with people, but you know, working to these outcomes helps structure everybody's work. I think what's clear about it is it shows what's important to do. Okay, you guys are a very quiet group. No one's interrupted me. I mean, Connecticut does tend to be a little better behaved than some other parts of the country. I'm going to pause and see if there are any questions or comments so far on the values, the visions, the goals. For some of you, that's the first time seeing it kind of put out because it really comes out of the manual and really, I think, synthesizing a lot of what you've been hearing for a long time. But are there? No? Okay. You can be quiet. It's okay. But we want to give you an opportunity. And soon we're going to have a breakout, so you'll be talking to other folks. So as we said, the outreach workers and outreach staff have a lot of different jobs. First of all, sort of understanding who in your area is unsheltered. And that means canvassing, checking in with other outreach teams. We know that PATH is one outreach team, and a lot of you may have a VA outreach team in your jurisdiction. There are also DOH outreach teams. There are also some, I think, psychiatric outreach teams. I think there's a few different kinds of outreach you may be connecting with. So really connecting with their partners. Creating relationships with people is a really key responsibility. Maintaining contact, showing up for people. We'll talk about engagement more. And then helping people move forward in their goals. And that may start with a really little step, but the steps hopefully leading towards housing. And then get your data, enter your data into HMIS and the DDAPs. I don't want to look at people's faces when I talk about data, but it is a really important responsibility. Doing case management with a housing focus. We're going to talk about that today because that's really important. That's really, really core in Connecticut, is having a consistent approach to assessment and service planning in a way that works for people, that is really housing focused in terms of assessments and creating service plans, and then working with your partners, right? So you're not alone in this. I think one of the nice things about the way it works in Connecticut is it really trying to work on a coordinated basis with others in your geography to figure out what to do. This work is complicated. People have a lot of special needs and conditions, and having partners and working with your partners really expands the possibilities for people and expands the opportunities, I think, for success. Brenda, were you looking like you wanted to jump in there? I just wanted to check in.
Nope.
Okay.
I'm good. Thank you.
Okay. All right. So now we're going to give you a chance to talk. Now, maybe you'll talk a little bit more when you're in a smaller group. I know it's not everybody's favorite thing to yak on Zoom. So we're going to break you out into groups of 3. And it's really simple. This is like a kind of get to know somebody else. It's going to be a random assignment, is to talk about what led to you to apply for your current position and how you kind of see yourself as contributing to that vision and those goals that we talked about. So I am setting up the breakouts. We're going to give you about, I guess, 6. We didn't really talk too much about it, about 5-6 minutes. If we have 3 people, 6 or 7 minutes. We'll give you a warning. Sorry, we'll give you a warning when we're about to close the rooms. Okay, some of you may have 4 just because of our numbers. So if there are 4, say hi to all four of each other, introduce yourself. Okay, so doing a breakout, again, is an active thing. You need to join a breakout room. A pop-up will come on your computer somewhere saying you've been assigned to room 6, I think, or 5 or 4, and then you need to join that group. And if you get stuck, you can come back to. Okay, welcome back, everybody. I think everybody's back now. Let me see. Participants 23, is that where we were? Around 23? I think so. Yep, okay, great. Well, did you guys enjoy talking a little bit to someone else? At least you're not talking to me, but did you enjoy talking to each other? Anybody want to share?
Yeah. It was just nice to get to know somebody for
What their
someone.
passion is for outreach? I'm always happy to hear somebody's passion.
I think we're all, I think we're all passionate for the work that we do. And we talked a little bit about, because it's my main concern, trying to learn path and the like what's due when and what do you do, and getting the data in, because I know data is very important. That drives funding, right? And we all need funding. So so anyway, yeah, so I was expressing that I was hoping we were going to cover that today, because it's what I find most confusing. Yeah, and I was validated in my group, so thank you, group.
Okay, well, we are going to cover data somewhat, but I think maybe you'll have some feedback that will impact what we put in session 2. Or perhaps there's some, I don't know, once we understand what the data barriers are, that would be good. We could maybe address them. So thanks for bringing that up.
Great, thank you.
Anybody else want to say what makes them do it, what they hope to do? You guys are a very shy group. Okay, but that's all right. That's who people are. Just like we are accepting our clients where they're at, we're accepting you guys where they're at. You guys are at. But encourage you, if you feel more warmed up or comfortable, to talk. Okay, so I'm going to move on because we do have a lot. So, you know, there is just a lot of resources that we're going to be giving you. As we mentioned, there's a quarterly outreach meeting. You can see here how to join that meeting, and there'll be discussion about those outreach standards, as we said, which are being finalized right now. The ink is wet on them. And, you know, this is about, at the core, engaging relationships with people. And so we want to talk a little bit about engaging people and connecting with them. And that the really number one on day one, when we're working as a street outreach worker, is to, you know, give the person a reason to engage with us. What are we offering that they need? And that involves, and we'll talk a little bit about it, but a mutual conversation about what they're interested in, what's bothering them, what will make them happy, and aligning what we can do with what those needs are, and creating a reason for people to see us again. And that doesn't mean we step out of our role, but it means within our role, we need to know what we can do. Can we get people medical care? Can we get them food? Can we get them money? Can we get, you know, what can we get them? But always thinking about how that connects into housing. And when we're engaging with people, you know, most of the folks you're working with are people who have had a lot of trauma, both pre-homelessness, and homelessness itself is a trauma. And post-homelessness. People have seen violence, they've been poor, they've been emotionally abused. They might have gone, I just read about this person who's been in prison in New York City and was homeless, but has been sexually assaulted 3 times in prison, right? Like, so you're in a system that's supposed to take care of you, and the system doesn't take care of you. People have been through awful things, have medical issues a lot of times, and pains and things that they need relief from. So folks are bringing a lot to us when we meet them, right? And understanding all this is not going to come on day one. I think everybody knows that, that relationships take time, but we're approaching them with a trauma-informed lens, and that we are assuming for most people that they have had some trauma, as I said, and that it's important for folks to feel like they are safe. It's really important not to threaten people or make them feel unsafe. Like for some people, meeting in a room alone with someone is going to really feel unsafe. Or for someone not being able to see the door is going to make them really feel unsafe. So we really want to make sure we're thinking about how safe people feel, that they have a sense of control in the relationship, that we are offering options, and that having experienced trauma affects a lot of things: how you sleep, how you relate to people, who you like, who you don't like. A little thing that seems like nothing to you can really upset the apple cart for people because it's related to something that's happened in their lives. So we want to be safe. We want to be predictable. We don't want to surprise people. We don't want to, fake people out. We want to be safe. We want to be predictable. We want to help people have as much control as possible, and help people also realize their strengths, right? Like, it is not easy to be homeless on the street. It takes a lot out of people, and you need a lot of strengths to manage and to survive. And we want to think about that with everybody we're meeting, is what are the strengths that they're bringing to the table and the skills that they have, and then help them develop them more. So I'm going to run through this because I think this is really a big topic that you are all talking about in your team meetings. But how do you build a relationship is be authentic, be real, don't push the agenda, keep showing up. There's a lot of tips here. Give people things that they need. Do they need socks? Do they need COVID, the vaccinations? Do they need hand sanitizer? Do they need masks? Do they need internet access? You might need to also get some clinical consultation. People may have had head injuries. People have complex mental illnesses. And PATH is working, the primary, Lauren will talk about this, but the population is people with serious mental illness. So we might need clinical consultation in order to understand how to engage a person who might have a head injury that affects them, for example. And then also make sure that you are trying to find out from the other partners what people know, especially with folks who've been homeless for a long time. Most of your partners, most of the people who have been homeless for a long time are known by multiple partners. Sorry. Skip it. Just be mindful, as I said, people have been traumatized, but there's lots of barriers to engagement. They're listed here, but people have had, and I think the biggest barrier is lots of promises and relationships of turnover with staff or things that didn't happen, but they also have a lot going on in their heads or bodies that may cause it. At the end of the day, it doesn't really matter what's causing the barrier to engagement. Is it their mental illness? Is it their substance use? Is it that injury? Is it that I look like that last worker who they didn't like? Is that it is our job to work through those barriers and to engage people in spite of them, right? And focusing on the cause might help us, but ultimately, if we're not connecting with somebody, then we need to shift our approach, right? And I think everybody understands that. So we want to offer things in different ways. We want to help people with things that they identify as important. We want to make sure people get what they need: money, resources, connections. If we can get people housing, obviously, that's very client-centered. So now we're going to have breakouts again, giving you a chance to talk about, and Janet's going to put this question in the chat box, but it's pretty easy. And we're going to give you a little bit bigger groups this time to talk about a client, either who you have had trouble engaging or you're currently having trouble engaging, and what some of the barriers have been and how you're thinking you might overcome those barriers. And so now we're going to break you up into larger groups of 5. I can get, for some reason, my menu bar has gotten wider. Okay, I've got polls, breakout rooms. Okay, create. Okay, so again, remember with breakouts, we'll give you about 5 or 6 or 7 minutes on this, but we have to keep moving so this is going to give me 5 to 6 participants per room. Okay, so you need to join a group actively. Push that button. Okay, create, and I'm opening those rooms. And we'll give you a warning like we did last time. Thank you, Shannon. Lauren, you pick up next, right? Okay.
Yeah, I pick up on the contacts and enrollment slide.
Yep, that's what I had in my notes. I just want to make sure I wrote it down right.
Yeah, so I'll just cue you to advance the slides, I guess, so we don't have to change the share.
Yeah, I mean, I guess you could, they have a thing now, a new button where it says share slide control. Do you see it on your menu?
I have share. Is it under the share option?
No, like when you have your different, sometimes you see different levels, like there's annotate, there's pause share, there's polls, there's chat, and then there's a new button called slide control, but you have to be in PowerPoint presentation mode.
Oh, I don't have that.
I think it might only come up when you're sharing also. I think it may be that kind of a thing.
Okay.
I know I tried it with Andrea. I said, oh, let's see if I can give you slide control, but it said it was only available in presentation mode, which I think is PowerPoint presentation mode. So somebody, and I'm going to try it again, not today, but somebody else was sharing, and they were sharing from PowerPoint. And remember in the beginning, we had a lot of trouble because it was loading slowly. So I'm going to try it again and see how it is going now.
I have the same problem with when I try to share in full view, it doesn't advance smoothly and quickly. So I have to do it in the, I share the whole screen and then I just minimize the noise on the sides. And
Yes, I do. Yeah.
PDF that way, because otherwise it's like jumpy and slow and.
That's what I thought. We had tried it in the beginning, and that's why we went to PDFs, because they load more quickly and it's not the same thing. Okay, I'm going to give them a 2-minute warning. I think I started this at 10:45.
Yeah.
We have no more breakouts, so.
When you close the room, it takes a minute, but they said Zoom said you can adjust that time if you wanted to. You could make it 30 seconds or 2 minutes or whatever you want.
Oh, I'm kind of adjusted to the minute. I like it. I think it feels, because people a lot of times take that whole minute because they're still in the middle of a sentence or something.
Yeah.
So I usually I don't mind that. What I wish they would let you do is put the slides and the breakout questions and all that stuff, like have a spot the way Adobe Acrobat did. It was in Adobe, like in the old version of crappy software.
It's so weird that you can't share slides to the breakout room.
You can't share slides, but you also can't, like when we're setting up the day, I want to put the slides up. I want to put everything there that people need to access, but you can't share anything. If they join, their chat only shows. It's just a very annoying feel. Like, to me, that seems like a feature that they should be able to do something about.
Absolutely. There should almost be like a sidebar where it's like documents for today, so it's not buried in the
Yeah,
chart.
that's what,
It's like a separate place where people can just grab whatever they want, whenever they want.
Yeah, what was it? What was it we used for the VA? That's how it was with I think it was Adobe Connect, I guess. And you could put your files and your chat, and it was also like easy to make tiles, which I find hard in Zoom to keep tiles. Like the chat is always for some reason rolling around. I can't, it doesn't sit. And, I'm not saying that it was great, but it was better in those ways. So, all right. So I think I have to close the rooms because the minute's up. All right. I'll just give a minute, Lauren, just so to not be disrespectful to people, to see if anybody wants to shout out anything. I do feel like I talked pretty fast.
Yeah.
Welcome back, welcome back. Welcome back. Some people are still gabbing. So the breakout rooms give you a minute warning. So we'll give everybody the last, there's another 10 seconds or so to go before we reconnect. Hopefully you're enjoying talking to each other. Anybody want to give me a thumbs up on that? All right. All right. You can hear me. Proof. I know I can be quite annoying that way. I miss training people in person and all that jazz. Okay, so I think all the rooms are closed. Welcome back. Does anybody want to share any creative engagement strategies? I mean, that's one of the areas where you get to use your creativity is in how to figure out how to connect with somebody and give them a why to meet with you. Does anybody want to share anything? No?
I'll share what one of the individuals in our group shared with us, and I thought it was great. He was having difficulty engaging somebody due to their mental health and their substance abuse. He ended up setting an alarm on their phone as a reminder that he was going to call, and it actually increased their engagement. And I just think putting an alarm on somebody else's phone for them as a reminder, like, hey, you've got this person and they're going to call. I thought that was really creative.
That's great. Thanks for sharing that, Elisa. It is. It is. And using that technology or helping people use technology too to remember things, right? Like sometimes people don't meet with us because they forget. So that's really great. Thank you for sharing that. Okay. I'm going to turn it over to Lauren unless somebody starts talking over me. And she's going to now talk fast, like I've been talking fast for the last little bit.
Hi, everybody. It's good to see many of you on camera. I know a lot of you guys already, and I look forward to getting to know those of you that I don't already know. Shannon and I are actually going to be starting tomorrow with monitoring visits. So a lot of the folks that we haven't had a chance to meet yet will be meeting in the coming months when we do those monitoring visits. So we're looking forward. So we're going to talk a little bit right now about eligibility for the PATH program. And there's really sort of two concepts related to eligibility. So the first is, you guys are out there all the time, canvassing out on the streets, going to the parks, and you're going to encounter a lot of folks, right? And not every single person that you encounter are you going to be able to enroll in the PATH project. So there's some folks that you're going to encounter, and maybe you're going to, try to engage them. They may or may not be receptive, at least at first, to those attempts. Maybe you're going to provide them with some light touch supports, some information and referral until the point that you actually enroll them into the PATH project. Those people we call contacts, right? In order to enroll someone in the PATH project, which basically means that you enter them into your PATH project in your HMIS program, they've got to be homeless, of course, but they also have to have a serious mental illness. So that is the SAMHSA, which is the federal funder for this program. That is a SAMHSA requirement that you can only enroll people in the PATH program if they have a serious mental illness. And the definition of what SAMHSA means by that is here on this slide. I won't read it to you. So next slide. So there are a number of ways that you can document that every person that you have enrolled, in fact, meets that serious mental illness or SMI criteria. And the first way is people probably know, unless you're real new, that Connecticut has a statewide form. We call it the disability verification. Some of you may have heard it commonly referred to in the state as the DV. So if you've heard that and wondered what it means, not only does DV mean domestic violence, it also means in Connecticut, disability verification. And that's the form that really sort of officially says this person has been diagnosed by a professional to meet the definition of disability. including for the PATH folks to meet the definition of a serious mental illness. Now, that's kind of like the gold standard, right? We want to try to get everybody that we've enrolled in PATH a disability verification for a couple of different reasons. One, because if you suspect that somebody has a mental illness, it's really important to get them linked up to a clinician as quickly as possible to get a full assessment, so that then they can get linked to the services and the supports that they need for their disability, right? So that's the number one reason. It also, getting that person the official DV, the disability verification, really opens some doors in terms of housing. So you'll need a DV, for example, in order to get somebody into permanent supportive housing. So for everyone that you enroll, if you don't already have a disability verification, you want to be working to get a disability verification as soon as you can. But in the meantime, you can still enroll them as long as you suspect that they have a mental illness. So there are a couple other ways that you can document a mental illness. One is this it's called the modified mini screen. It's a standardized assessment tool. It's just basically some questions that the client asks, and we're going to be doing a training on that tool next week. So we definitely encourage you guys all to attend that training. There was also on the last slide a link to some guidance on documenting SMI for people in the PATH program. So there's a lot more detail on that guidance than what I'm talking about here. The third option is you could also just document in the case notes what you're seeing, right? So, maybe the person isn't even willing to do the MMS, the modified mini screen. You can just write, person told me that, the FBI planted a camera in their brain, or a person is, frequently responding to voices. So again, you don't have to have a clinician diagnose somebody. Please get them enrolled if you suspect serious mental illness. Okay, next slide. Actually, two more slides. Yeah, one more, Suzanne. Yep, there we go. So we know that lots of you probably have experience either in other jobs or have been in this job for a while and have some experience working with people with mental illness. Some of you may be brand new to working with folks with mental illness. So if working with folks with mental illness is new to you, there's a webinar that we did maybe a year or so ago. It's recorded, it's up on the website. The link is here on this slide. So we definitely encourage you to attend that if you feel like it would be helpful. Next slide.
And Shannon is putting a lot of resources in the chat box for you guys. You can obviously get the PowerPoint, but she's also putting a lot of stuff up for you. Okay.
And everything, all of these documents that we're linking in the slides today, as well as the slides themselves, are going to be on the CT Boss website. And so you'll be able to get them there. If you're having trouble accessing them from this chat, no worries. Okay, so I want to talk a little bit about safety. Absolutely one of our top priorities is always going to be keeping everyone, including you guys as the workers, safe. And I just want to start front and center by saying that people with serious mental illness and people who are experiencing homelessness are far more likely to be victims of violence than they are to be perpetrators of violence. So we're going to talk a lot, for the next couple minutes about how to stay safe, but we absolutely are not trying to send a message that all of your clients are dangerous. It's just not true, right? Most of your clients have been traumatized and victims of violence. Very few of them have been perpetrators of violence.
Lauren.
Yeah.
Before you jump in, I think Brenda wanted to say something.
Yeah, go ahead, Brenda. Oh, sorry.
Yes, thank you. No, I just wanted to quickly, you don't have to go back the slides, but before safety, I just wanted to make sure that there's no questions around what Lauren was saying about suspected mental illness. I've heard things over the years. Maybe a PATH provider won't take this client because they don't have a disability verification, or they won't take this client because they can't prove that they have mental illness. So I just want to make sure, Lauren said it perfectly. You can still enroll them if it's suspected. You could put notes in your case notes. I just wanted to make sure, 2 seconds, open it up. Are there any questions around that? Is anybody confused around that? Please unmute and ask.
Thanks, Brenda.
Yep. If not, then we can jump back into safety. I know that sometimes that's like a myth buster out there that PATH won't take you, and that's not true.
Okay. I don't see anything. No, okay. So should I go to the next slide,
Yeah, go to the
Laura?
next slide, please, Suzanne. So these are just some tips, some important things to keep in mind when you're out there in the field. I think the top one is really just to trust your instincts. We want to be careful and do everything we possibly can to keep yourself and your team members safe. One of the ways that we do that in PATH is to make sure this is a requirement for all of the agencies, to make sure you have a system whereby anybody who's working out in the field has someone back in the office that knows their field schedule, knows where you're going to be when, and that there's some sort of predictable schedule on which that outreach worker is checking in with someone back in the office, so that if you don't check in as scheduled, we know that there could possibly be something up and we're going to be following up to make sure you're okay. The other thing is that all of your agencies have protocols specifically for outreach worker safety. And so those should be in writing. So if you're an outreach worker and you're not familiar with that protocol, please ask your supervisor, and then by all means, please follow the protocol because it really is intended to keep you safe. We definitely want to make sure, even if someone's sleeping on a park bench, right, that park bench is that person's space. So we want to always make sure that we are respectful of people's space, of their boundaries, of their privacy, and are really asking permission to enter that space, even when it is a public, what we would normally consider a public space. We also want to make sure that we know when is a good time to engage and when may not be a good time to engage. And so, for sure, if someone is super intoxicated or agitated, right, that's a time to just say, hey, now today's not the day. I'm going to come back and check on you tomorrow and walk away, right? If your instincts are telling you that there might be a drug deal going down, right, that is not the time to engage, right? You want to, again, just step away from that situation to make sure that you keep yourself safe. Whenever possible, we always encourage outreach workers to go out in pairs. We know that that is not always feasible. Some of your programs only have one outreach worker. But in every community, there are multiple outreach teams that are working within a CAN. And so even if you are in your PATH program, the sole outreach worker, you should be scheduling to go out with a partner from one of those other organizations in certain circumstances. So for example, we don't want people going to encampments all by themselves, right? We don't want people going to places that are not visible publicly by themselves, right? So if you're headed down some remote train tracks, you don't want to do that by yourself. You really want to make sure that you've got someone going with you. Also, want to make sure that you only are carrying what you absolutely need to carry. We'll talk about a cell phone in a minute, and that all other valuables get left behind. That you're dressed in a way that makes it possible to move quickly if you need to move quickly. And that you trust your instincts. And if there's a crisis that is emerging and you feel like you need backup, you need help, by all means, call 911. Or if it's less of an emergency, call a colleague, a coworker to come and join you. It's really important to understand in your community how long it's going to take emergency responders to get to you. And that can be different from town to town. So to really understand what is that response time that's typical, so that you know how long you're going to have to do your best to manage that situation safely, or remove yourself from the situation if you can while you're waiting for help to arrive. Next slide. So a big part of staying safe is definitely planning ahead, right? So you always want to make sure you've got a fully charged phone, right? Bring your charger with you, charge that phone in the car while you're between visits. You don't want to be stuck out someplace with no battery on your phone. You really want to make sure you're always aware of where the exit paths are in any situation, and try not to get into physically in a situation where there's someone between you and the only exit path. It's really best if possible, if you're aware at all times of multiple exit paths. And then also there's some things that you want to have conversations with your clients about in advance so that they know sort of what are the ground rules for the visit. So an example of that might be if somebody's got an especially aggressive pet, right? They know that, I love that alarm idea, set the alarm on their phone so that they know you're coming at 10 and at 9:45, they should tie up the dog, right? Or, you know, if there are weapons, right? You're not going to be visiting, you know, when there are weapons present. And again, if someone's, you know, really drunk, you're going to say, hey, you know, today's not the day, I'll come back and see you tomorrow. One possibility for trying to avoid attempting to engage someone that's really intoxicated is to try and schedule early in the day. People tend to drink during the day and get more intoxicated as the day goes on. And though, like we said, it's, you know, uncommon for clients to have, you know, real serious histories of repeated violent behavior, you do want to know as much as you possibly can about your clients, right? So you want to know if there's a history of violence in the past, whether or not that was an isolated incident, whether or not it's really a pattern of violence, and then plan accordingly, right? There might be some people that you make a decision in consultation with your supervisor that we are only visiting this person in pairs, right? We're not visiting this person alone because of a serious history. And then it's always good to try and get to know your local police, to build a relationship with them in advance, so that you already know them when you need them. And then in addition to doing all of these things to plan ahead, right, we really want to take every opportunity where there is an incident, right, to look back and say, what did we learn from that, right? All of your agencies have incident management, reporting protocols, hopefully incident management protocols that define what is an incident and what you're supposed to do when an incident happens. And we hope that you're using those incidents as a way of debriefing with your team, figuring out what went well and what we're going to do differently next time. Next slide. So we don't have time to go deep into de-escalation today, but we did want to show you guys these resources. There's some great tip sheets, some great trainings, and some articles. So click through some of these resources when you have a chance. If you've never taken a de-escalation training, it's a really good thing to do. You know, there's just some pretty simple tips for how you can make it much less likely that an incident escalates into something really dangerous. Next slide. All right. So the clients that we work with, I don't have to tell you guys this, face a lot of risks, right? And so part of our job is to help them to understand those risks and to reduce those risks. So we've got folks that are living outside, they're at risk of being exposed to, you know, dying on the streets because of the cold, because of the heat. You know, lots of folks are victims of violence, of sex trafficking, of drug overdose. That's a huge risk that folks face. And so it's really our job to help clients to evaluate what are the risks that they face in their life and what are their options for reducing those risks. So all of us take risks in our life, every single person, every time we get into a car, right, we're taking a risk. And my tolerance for risk is going to be different than your tolerance for risk and different than your client's tolerance for risk, right? So it's not my place to judge what risks are okay for Shannon and vice versa, right? My job is to help the client really understand what risks are what are your risks, what are your options to reduce those risks in a non-judgmental way, right? So some examples of, you know, risk reduction strategies that we might use with our clients, helping them to get naloxone, right? So that if they're shooting up, right, they're at less risk. Fentanyl is a real huge risk for people now. Helping them to be at less risk for an overdose, helping them to figure out how they might use in the presence of other people so they're not using alone. That's a huge overdose prevention strategy. Helping people make decisions about where they're going to sleep tonight, because some places where they might sleep might be more dangerous than other places. And really always remembering that every person is the expert in their own lives, right? And knows what's best for them. So even if the risks that they're taking are not ones that I would take, just that my role is helping them to make the best decisions for them. Next slide.
I'm gonna do a commercial for the harm reduction plan, because I just think it's a really great tool. It helps us break down when someone's faced with a problem, talking through what the options are to reduce that risk. And so it gives people a sense of control, like we talked about, but also expands choices that people might not have seen before. So just a quick commercial. I know it's in some of the other trainings, it goes deeper on that, but
Thank you.
very helpful.
And clearly, in this environment, in the middle of a global pandemic, right, one of the biggest risks that we all face is, getting sick with COVID. And so I know, a lot of your agencies have really struggled with staff absences, particularly during Omicron. And so, I think at this stage in the pandemic, you guys, even if you're brand new to outreach, you're all familiar with what are the basic strategies that we all can take to protect ourselves from COVID. They're the same. Whether you're going to the grocery store or, doing street outreach, wear a mask, wash your hands, right? And really the two most important things that you can do to protect, well, the most important thing you do to protect yourself really is to get vaccinated and boosted. And I know that that's a, complicated matter for some folks, but if you haven't, hope you'll consider doing that. We know that meeting outside is definitely safer than inside. So wherever you can, be meeting with folks outside. If you have to be inside, ventilation is the name of the game. So open those windows, put some fans in the windows, get the air flowing. And then the graphic actually this is there's a graphic that we'll put in the slides that has some new research from the CDC that really shows that an N95 or a KN95 is way more effective at reducing your risk, right? So a KN95, which are fairly comfortable, more than an N95, is going to reduce your risk of COVID by 83% compared to a surgical mask, which is only 66%, and a cloth mask, which is only 56%. So if you've not upgraded your mask, we really encourage you. At the beginning of the pandemic, they were saying, don't use N95, save them for healthcare workers. Those masks are now widely available and pretty inexpensive. So if you haven't upgraded your mask, consider that. All of the CDC's guidance for folks working in unsheltered settings is linked on this slide. We're not going to go through it all, but please feel free, if you haven't already, you should definitely check that out. Next slide. And then of course, in addition to keeping yourself safe during COVID, you want to take steps to keep your clients safe, right? And the most important thing you can do for your clients to keep them safe is to help them get housed as quickly as possible. That's going to reduce not only the risk of COVID, but of all sorts of other things. And then also to help them get vaccinated and boosted. And then, obviously recognizing that folks that are living unsheltered face different risks and different challenges than the rest of us do. You want to help them make sure that they've got a way that they can clean their hands regularly. They've got access to shower facilities. And we talked a little bit about some of the overdose precautions earlier. People's risk of overdose is definitely heightened during the pandemic. So we want to pay close attention to that. All right, I'm not going to go through everything on this slide. Next slide. So want to, again, give you guys a little bit of a chance to speak up here and keep you all awake. So we're going to ask you if you want to put in the chat box to share with your colleagues here, what are some strategies that your project uses to keep outreach workers safe, either all the time or particularly during the pandemic? And then what new strategies, things that you're not already doing, would you like to implement? And when you put it in the chat, if you could say whether it's something you're already doing or something new, that would be great. I'll give you guys a couple minutes to get some ideas up there in the chat.
People could shout out too, right, Lauren?
Yep, absolutely. Absolutely. You can also unmute yourself and shout out.
Looks like no one's doing anything.
I know you guys are taking steps to stay safe.
A couple of laughs there. A couple of you laughed. You knew I was making a joke. Okay, so someone's just.
So somebody says, I definitely feel safe with the buddy system. So I think a lot of programs are really always going out in pairs. So somebody's saying that they're using other programs to pair up with. Lots of votes here for the buddy system. Check out and check in, right? So making sure that the schedule of where you're going to be when is transparent to folks in your office and you're checking in. Doubling up has been a challenge. Accessing other resources and community care teams, et cetera, has been helpful. We've got later in the presentation some slides that go through who are all of the outreach, not all the outreach teams, but at least the DOH teams and the PATH teams that work in your areas. So those might be some opportunities to connect with other outreach workers to make sure when you need it, you've got a buddy to pair up with. Another vote for supervisor, knowing where you are. A sign in and sign out log. All right.
I think Elizabeth is unmuted. Did you want to say something? I want to make sure you have the opportunity.
Yeah, I was just gonna agree. Actually, it was already mentioned, but the call-in method. So if our outreach person is out in the field and there's already a schedule in place, but sometimes a crisis can arise at any point in time, right? So there may be a detour. So our system is to immediately call, going back to the safety protocol of always having and making sure your phone is charged. So that was one of the safety protocols we really stick to.
Thanks, Elizabeth. Yeah, so not just putting a schedule there that is then bears no resemblance to what you're actually doing, actually letting your supervisor know when you've got to, like Elizabeth said, take a detour because your schedule is going to change. So thanks, Elizabeth. All right. Should we move on? Any other burning thing? Okay. So, so these are just some resources. Connecticut has really done a great job of coordinating across the state and has really been a leader in the COVID response. And this is a resource that's available on the state's website. It's got some really helpful information about where are the vaccination sites around the state, where can you get no-cost testing. It's got the schedule for the DPH, the Department of Public Health vans that go around to offer vaccination clinics. And it also, this is a great thing to do. I'm sure many of you have done it already, to host a DPH van to go out to where your clients are. It's very hard to get the clients to come in for a vaccination, and those vans can go out, meet people where they are, and get folks vaccinated. So if you haven't already hosted a DPH van site, you can find out how you can do that here on this link. So, okay, next slide. So as we said, definitely the most important way to keep people safe is to get them housing. And that is our primary goal in the outreach program. So we're going to talk about housing first and housing focused case management. So housing first really is at its most simple, this radical idea that every person, simply by nature of being a human being, is ready for housing. Right back, I know when I started working as a case manager back in the early 90s, people had to jump through 1,000 hoops in order to demonstrate, to prove to us that they were ready for housing. You had to be clean and sober, you had to attend a certain number of AANA meetings, you had to be compliant with your medication. And ultimately what ended up happening is that there were a whole lot of people that we were never touching, we were never helping them. And in a lot of ways, we were helping the people, we were not helping the people who needed the help the most. And so thankfully, that has really changed in our system. And so now we operate in what we call a housing first system, which I'm sure is very familiar to many of you, but for some of you that are new, which is really about eliminating all of those barriers to housing, but then it's also about making sure that it's not just that we put you in housing and then we say, hey, later, bye, good luck, right? Once you've finally gotten into that housing, we're going to wrap you up in supports to help you stay stable and to prevent you from returning to homelessness. So next slide.
Sorry.
No, you're good. So the cornerstone of Housing First practice, of course, is to move people into housing first and quickly, right? So we're not going to wait for people to, fix all of these other problems that they have before they go into housing, because we recognize that housing, the stability that housing provides, is for some people necessary in order for them to be able to take the other steps that they need to take in order to get healthy and lead a connected, fulfilling life. So, it's really a process, not an event, Housing First, right? So, and the beginning of that process is really all of the engagement stuff that Suzanne talked about earlier, and helping people to connect to why they want housing and why they want to stay in that housing once they get it. And we'll talk about that in a minute. Also essential to Housing First practice is, doing a really comprehensive job of understanding who someone is, what matters to them, what they want out of life, right? So that we can help them through a housing plan or a service plan, which we're going to talk about in a minute, to really achieve the things that matter most to them, not the things that I care about, right? And then we just talked about harm reduction. That's a core practice in Housing First. And then we also want our services to be recovery oriented. And basically what that means is that it's a way of recognizing that despite any challenges that someone's had, whether it's mental illness, addiction, homelessness, trauma, right, that people are resilient and that people are able to recover from those things and lead a healthier, happier, more connected life. And that's what we're working with them on. And we do that both not only by the services that we provide, Suzanne talked about this earlier, but also in partnership with everyone else in the sector, as well as with just regular folks in the community, right? So we're gonna connect people to as many services as they need and want. And we're also gonna connect people to informal supports. Maybe they want to go back to church, maybe they want to play softball, maybe they want to get a library card and spend time at the library, right? We're going to connect them to whatever those things are that for them are going to mean a happy, fulfilling life. And everything we do, what a happy, fulfilling life means to me is different than what it means to Suzanne or to Shannon or to any of our clients. And so all of the work is really going to be driven around what matters most to that person and is going to be completely individualized. It's not a cookie cutter, here are your 3 options, A, B, and C. That's not the approach that we use in a Housing First model. Okay, next slide. So how do we do all this, right? So the one of the ways that one of the core components of housing focused case management is service planning. And service planning, I think often we think about service planning as being a form, right? It's a form that we have to fill out. It's a thing that we have to do every 6 months, because otherwise when Shannon and I come and monitor, we're going to say, hey, this was supposed to be done every 6 months. But that's not what it is, right? That form is really just the documentation of all of the work. And the work really starts with engagement, right? So building that relationship. You can't start to talk to people about what their goals are if they are not willing to talk to you at all. And it really is helping people, giving them that why, as Suzanne talked about before, for why they're going to talk to you, right? People have had lots of terrible experiences with services that did not work for them. So they are not going to necessarily trust at the first contact that you've got anything to offer them. So in Housing First, we really talk about the services being voluntary for the clients, but not for the staff, right? So it's your job, it's our job collectively to make sure that the clients want to engage with us, want to, work on goals with us, because they believe that I'm going to be helpful and that I've got something to offer them. So the requirement for service planning, PATH has a standard template for both assessment and service planning. It's linked on this slide. I think Shannon just put it up in the chat. And the goal is that it's completed within 30 days of enrollment. And that's not just, a bureaucratic goal, just randomly for, bureaucracy's sake. It really is about the fact that living outside is an emergency, right? People who are living unsheltered are in a state of emergency. And so we want to have urgency in everything that we do to try to end that unsheltered homelessness for that person as quickly as possible. So we want to engage them quickly in some sort of service planning process. But again, it's not a requirement for the client, right? So the client may say buzz off. The client may say, it may take you months, sometimes years even, for some folks that are, really paranoid. Sometimes it may take years before they're even willing to have a conversation with you. So, so you want to try to engage people within 30 days if they're engaged with you, but certainly understanding that that might not be possible for every client. And then the goal is to update that plan at least every 6 months. Next slide. So, and the needs assessment really is, again, it's not a piece of paper. It is a piece of paper, right? But that's not the paper is not the point of the needs assessment. The point of the needs assessment is for you really to know this person, right? To know who they are, to know what they care about, so that you can find ways of working with this person to demonstrate that you can be helpful with them, so that you can continue to build towards the ultimate goal of, getting people housed, absolutely, but also whatever the other things that people care about in their life are. And so again, needs assessment is a process, right? If you come to somebody and you say, hey, we have to fill out this form because it's due, like, not super motivating, right? That's probably not going to be what motivates somebody to talk to you. They're going to talk to you because they trust you. They think that you're in their corner. They believe that you're in their corner, and they think that you've got resources and are going to help them achieve things that they care about. And so really, needs assessment is about every single conversation that you have with someone, from the day that you meet them all the way to the end of your work together, and also every conversation that you have with everyone else that knows this person and works with this person. And the form really is just where you write it all down. But it doesn't have to be like, we definitely, especially in street outreach work, right? Like, carrying that form out with you to the field and filling it out in the field may not be the way to go. You might want to just jot some notes down or voice record on your phone, because you're learning about people all the time, and then you're just writing it down on the form at some point, ideally within 30 days of engaging them. So, okay, next slide. Super important when we think about needs assessment, when we're working with folks that are experiencing homelessness, is we want to understand their housing history, right? Where have they lived in the past? Have they ever been a leaseholder? Suzanne talked about this a little bit before, right? Some people may have never had a lease in their entire lives, and they really don't understand the basics of what's required in a lease, right? They may not know that, it's important not to be loud after 10 p.m. because you're going to disturb your neighbors, and that could lead to you getting evicted. They may not know that moving somebody in or having somebody over and the way that they behave could also get them evicted. So we want to understand what experience people have had as a leaseholder. We want to understand what worked for them, what they really liked in places that they lived before, and what really didn't work, right? Why did they leave, or why did they get kicked out of wherever they lived before? We also want to understand a little bit about their homelessness, right? How long have they been homeless? Where do they stay? That's super important in outreach, so we know where we can find them. And what do they do during the day? How do they occupy their time? Who do they hang out with? Who's important to them? Who are they important to, right? Who do they support? Because people, just because they're homeless doesn't mean that they don't play an important role in other people's lives, and those can be strengths that we want to understand and leverage. So all of this, the assessment, the form for PATH is intentionally very simple and light and easy to fill out. So you're not going to write down all of this stuff on that form, but it is important that you understand all of this stuff about your client.
So there's a question in the chat box that is there a formal needs assessment form? And I think Lauren just answered that. I think this was going to be adjusted though. Is this the final with the new domains in it?
This is the current one. This is the current one that exists. Yeah. So
slight adjustment with assessment domains, because this doesn't really, the link on the previous slide takes you to the assessment and service plan form, but it doesn't include much assessment, as Lauren said. It's a very simple form.
Yeah, so we are working on updating that form, and we'll release that when it's available. But for now, the form that
there it is. Okay.
And Shannon put it up in the chat.
Okay.
There's a link to it in the chat. That's the template that's required for PATH programs to use.
I think the modification is going to be a simple checklist to indicate sort of assessment domains that require follow-up or a goal.
Don't worry, it's not going to be like the PSH assessment form that's 25 pages. So have no fear. It's still going to be short and easy for you guys to do. All right. So next slide. Oh, yep. Thank you. So service planning really is, again, right? Sometimes we think of service planning as a form, right? But that's really not what it's about. And in PATH, the assessment and the service planning are all one form, right? So there's some very basic assessment questions, and then there's the place where you're going to write down what are these person's goals and what are the steps that we're going to take together. What am I going to do, and what is she going to do, and when are we going to do those things to achieve those goals? And so it really is the structure for the work, right? It's the things that you're agreeing with your client that you're going to do together. And we really want, when we do service planning, right? I think almost all of our service plans are probably going to have on there a goal of getting a place to live, right? All of our clients are living unsheltered. Hopefully all of them, although maybe not necessarily, want a place to live that's inside and safe. But we really want to get when we do service planning, we call it the so that principle, right? I want to live in housing so that, like, what is the reason, the motivation behind wanting to live in housing? So like for me, right, it might be, I want to live in housing so that I have a place where my dogs can be safe, right? I don't want my dogs to have to live outside. Or, I want housing so that I can have, a date, sleep over at night, right? I want to have a place where I can invite a date. Or I want to have a place because, you know what, I really feel like it's been so long since I felt like my mom was proud of me. And I feel like if I had a place, she would really be proud of me. So really getting at that underlying reason can help people feel motivated to take the steps that are on that plan towards housing. And so the plan really lays out, takes like that thing that can feel very big for people, right? If I've not lived inside in 5 years, finding housing can seem overwhelming. And the service plan really breaks down that big thing into small, manageable steps. And as we achieve those steps, right, and we'll talk about this in a minute when we talk about motivation building, I may not believe, if I've been living outside for 5 years, I may not believe that I am ever going to find a place. I may have given up hope, right? But if I start to see, like, okay, first I have to get an ID, and now I've done that. And then I've got to get this thing called a disability verification, and now I've done that. And I start to see the progress that I'm making with your help, right? That's what really motivates me towards continuing to take those steps. So it would be great if you guys wanted to either unmute yourself and speak up, or stick into the chat box some of the goals that you're working on with people that you're working with, and even what some of their so that's are, right? Why is that goal important to them? What are some of the things that you guys are putting on your service plans?
Or your staff are putting on the service plan. Some
Or
of
your
you,
staff.
might be supervisors or. We're back in quiet mode, I see.
What are some of the goals you're working on with your clients? And why? Why is it important to them?
Hello,
Hi.
it's Leroy.
Hey, Leroy. Always good to hear your voice.
Always yours. So, one of my main goals is housing, but the problem that I had with a few of the clients, I'm dealing with one client now, and the thing that he's having problems with is getting all the documentations I keep telling him that we need. And every time he gets some, we'll need some more, then we'll need some more. And I'm continuing to tell him, this is part of the process. And he starts to get more aggravated because every time he turns around, it's more documents. And, I'm study working with him to try to get all these documents together so that once the application goes in, we could go from there. But then he worries about the background check after he gets all these documents. Is anything guaranteed? And I'm like, nothing's guaranteed, but we're not going to give up on it. If this don't work through, we'll apply somewhere else. So he's getting so frustrated with everything because of all the work that he's got to do to get all the documents together, and I'm willing to work with him with it, but he's like, no, I'm all right with it. I could get it done, but I just want a definite answer at the end, which I can't give him.
Yeah. So a couple of things I think you said that are super important, Leroy. You said we're never going to give up, right? So having you in his corner, feeling like, even sometimes when our clients have given up on themselves, right? You guys never give up on the clients. And so seeing you take all of these steps, to help can help him build that confidence and that hope, because this might be a guy that, feels kind of hopeless. Like, I'm doing all of this. So for what purpose? Because I don't believe that there's going to be housing for me at the end.
Right. Yep, that's it.
Another thing
it's very hard to tell people how it's going to happen exactly. And that really can be frustrating, as you said. Right? You can't say if you do X, Y, and Z, it's going to happen like this. And that's really hard for people.
Absolutely. Yeah. But as much as we can, we do want, and we'll talk about this in a minute, we do want to explain the process for people, because I think sometimes people don't, it's a complicated process, right? Getting housing is a complicated process, and people don't necessarily understand what all the steps are. And if we can help them to understand that up front, that can help minimize, it's not going to completely eliminate it, but some of this feeling like, well, first you told me I had to get this, and now you're telling me I have to get that. And so that's one of the roles that the service plan can play, because it really lays out for people in very concrete steps. Here are all the things that I'm going to do for you, and here are all the things that we need you to do. And at the end of this, I can't tell you exactly when, but until we get there, we're going to keep working at it until we get you a place to live. All right. So look and see some other things that people said. They're working with folks on identification, on connecting with family. That's a huge motivator. That's a big so that for people, right? People might not necessarily feel like they deserve housing or they're ever going to be able to get it, but they might be able to feel more motivated because it's going to be a place where their kids can visit them. That's one that we hear sometimes. Okay, let's keep going.
Well, and Elisa wrote entitlements and income, which is also a really great connector for people. Huge. Sorry.
Yeah. All right. So a humongous part of service planning is helping people to build motivation for change, right? Folks that have been living out on the streets oftentimes have lost hope. Right? They don't think that anything different is possible for them. And so, there are really these kind of three core components that we think about when we think about helping people to build motivation for change. So one is hoping them to build back that sense of hope. And for me, I always find it helpful to think about in terms of like my own goals and places where I may have lost hope or stumbled before, right? Like, it's February, right? So many of us maybe had some New Year's resolutions. 95% of us have probably given up on those New Year's resolutions because it's now February. And so, how do we how do we rekindle that sense of hope to be able, and how do we empathize with the clients? Because there are times in our own life where we've lost hope that something that we want is possible. And then meaning, right? A lot of times we see service plans where there's, the same goal or the same steps on the goal over and over and over and over, and not a lot of progress, right? And sometimes when that happens, it's because the service plan is really not meaningful to the client. It's meaningful to the worker, right? So the goals are really the worker's goals. It's really the worker's plan and not the client's plan. So in order to help people build motivation for change, we've got to connect to that, so that I want to have housing so that my dog has a safe place where he can eat his kibble every night, right? It's really connecting people to why is that thing meaningful to them. And then confidence, right? If I don't believe that I'm ever going to be a person that can get off the couch and stop eating chips and go to the gym, right? I have no confidence, right? You've got to help people feel like they're able to do it. And that's why the service plan is so important, because it really is breaking things down into these small manageable steps. And as people achieve those things, really building them up so that they have confidence that they can take on and achieve the next thing. All right, next slide. So we did this really quickly today. We've got a whole webinar just on assessment and service planning. It's recorded, and if either assessment and service planning are completely new to you, or the way that we're talking about doing assessment and service planning is different for you than what you've done in other jobs, you may want to check out this recording, and it's linked here in this slide. All right, next step. So accessing a temporary place to stay, one of the most important things that we can do for people is helping them to find someplace safe to be tonight. So we want to make sure that we're talking to people about what those options might be, about what's expected of them with those options, and really how it connects to what they want, right? Maybe they really don't want to be in shelter, but maybe you're having trouble getting them the documents that they need to be able to get into housing because you can never find them, right? And so going into shelter, maybe if it's only for a couple nights, helps you to be able to more easily connect and get them to something that they really want. So certainly that's an important part of housing focused case management. Next slide. Housing navigation. So obviously the most important thing that we do is helping people to connect to permanent housing. We've got to help people understand what their choices are with permanent housing. We have to understand ourselves how the CAN process works. What are people eligible for? What are the steps? About how long is it going to take for them to be able, once they're matched, to be able to get into that housing, or how long it's going to take for them to get matched, and really help people to explore what's going to work for them, right? What are their preferences? What are the things that are non-negotiable, right? So for me, leaving my dog, it's not going to be negotiable. I'm never going to leave the dog. So take any options that are about leaving the dog off the table right from the start. On the next slide, we've got a tool that we link to that's really a way to structure conversations about people's preferences around housing, having them define for themselves what's most important to them and they're not willing to compromise, and then things that are less important, that are more preferences, that they're willing to compromise, so that they can see, here are the available options, and here's what I said is most important to be, and they can pick from among the available options the thing that most aligns with what they want, even though it might not be 100% of what they want. It's a stepping stone to getting closer towards what they want than what they have currently. All right, next slide. And then this is really just a webinar. Again, if you want to learn more about using that tool I just talked about, or learn more about what the housing options are and how to talk to clients about it, here's another webinar that's recorded that focuses really just in on this topic. All right, I think I am turning it back over to Suzanne.
Yep, thanks, Lauren. And I know we're getting speedier. We only have about 15 minutes and we want to honor your time. And, as you can tell, there's a lot of other material for you guys to delve into, and we hope that's helpful. I'm just going to highlight a few things here. You know, helping people through the move-in process is really important, not assuming, Lauren already addressed this, that people know what it means to be a tenant or that they've signed a lease. Let's talk that through. Let's sort of make sure people understand that. And let's also help people feel like they're home and they're comfortable in their homes. You know, I don't think this happens too much in Connecticut, but in some places people move into their homes and they have no furniture. And it's really hard if you don't have a bed or anything else to really be comfortable in your home. So we want to make sure we help people get comfortable, and we also want to connect with them for 90 days to make sure that they're connecting with services, that they're adjusting to the housing, if they need resources, that we help them connect with them. And then we also want to be honest with people about, we know when your kids need things, you can often prioritize giving your kids money over paying the rent, for example. So we want to make sure that we talk about those housing risks with folks very matter-of-factly and say, what's the plan? How can you give your kids what you think they need and they want and pay your rent at the same time? And that's in another session, much more elaborated, but I think you all guys get the concept. This is a really important thing, is that the transition to housing is really rough. Even though it's great to get housing, for a lot of people, it brings up feels of failure. It's a transition. What am I going to do all day? How do I fill my routine? When I'm homeless, I have a routine to get my needs met. That looks very different in housing. So it, you know, and maybe I left the people at the camp that were my best friends. So there's some loss involved, or I left the shelter and I really like the case manager at the shelter. And, you know, that's really my loss. But there's a lot of anxiety around the transition. We don't want to assume for folks that it's going to be hunky-dory. And we want to reach for what the worries are, right? When we're doing our work with people around the support, not only we should be talking about what we may be worried about, but we should talk about what they're worried about, and what maybe doesn't feel so good for them. Like being home alone all day doesn't feel so good. So what can you do to get out so we can help them plan, and also create a predictable routine and schedule? Where's the pharmacy? Where's the grocery store? It might be in a new neighborhood, all these kinds of things. As much as we can, I already mentioned the warm handoffs, and I think many of you do that because it's the best practice, is really making connections between the outreach team and the outreach worker and other workers that that person is involved with, accompanying people to meet with the new provider whenever we can. So if the person's going to a new, you know, primary care doc or a new psychiatrist, or maybe a new AA meeting or a new NA meeting, that we go along with them to help them be comfortable. And then generally backing off as the new resources come in. And some of you do CTI, I know, critical time intervention, but really the goal is that the person, you know, when you're finishing, they're not alone. They have new resources, they have new supports, right? It's not like 90 days is up and so long, good luck. I'm not even going to say a word besides that there's some great resources here in the next 2 slides on income assistance. I know that you guys are really busy. I think Hannah, a couple of you mentioned getting people income. It's probably one of the most important things you can do that supports housing. It builds trust. People are historically not receiving the things they're entitled to, which is awful, and they're suffering for it. So we want to make sure we're doing some screening. Certainly if a person is a veteran, get them to the VA. Again, help people connect to these resources. And then also think about informal work. A lot of people do things for a few dollars here and there, maybe helping someone out. So we have some slides for you in this slide here, the Connect Connecticut, which is a tool that can help you see what you're eligible for. I think many of you have SSI, Outreach Access and Recovery, otherwise known as SOAR. You may have a SOAR worker in your past program, or you may have a SOAR worker in your community. But a lot of those folks are eligible for SSI. It's a complicated process, and that's a great resource. And then there's some employment resources. And then finally, there's a, almost everyone you work with should have been eligible for these economic impact payments that came out during COVID. So there's links here for how to get those rebates. And you do have to file a tax return, which for some people may be a deal breaker, right? They may not be willing to file a tax return because even if you had no income, the government needs you sort of registering that way. So that may or may not be great for people. This is a poll. I think I'll take a minute and launch the poll because we've been yakking for quite a while. Let's see what you guys think. I think Shannon's been putting a lot of things in the resource. Oh, yes. Shannon's just loading that chat box up with resources for those of you who want them. But now we're going to launch a poll about what kind of services your outreach team is providing. Okay, so there's 2 questions in this poll. I launched it. Which services does your outreach program currently provide? Which approaches are you using? And this, you can pick as many as apply. So these are all kind of concepts we've talked about. And then the second question is, which of these approaches could use more attention or maybe more emphasis in your program? So take a minute. I know we only have 9 more minutes with you guys, and you're already getting yanked away by something or somebody who's looking for you as soon as this meeting is over and you get off the Zoom. But give us a little feedback, on what services you're providing and what you should grow. I only got 1 response so far. Okay, getting up there. 2. It is a long question to read. There's a lot of options. Lauren, I'm going to roll this through to the end. Okay, just because to flip it back, I think will be a little bit complicated. Okay, about half of you responded. Oh, here you come. Give you another 10 seconds or so, because we do want to honor your time. Okay, I'm gonna, oh, great. We got about 75%. That's way better than most polls get. So I'm going to share the results. So which services are your program providing? We got about 75% of you everybody's doing housing first, excelente. Very close to everybody's doing service planning and housing navigation, which are really critical. And then after that, I guess our next one is the warm handoff and the aftercare. Really great, because warm handoffs and aftercare are evidence-based practices, and they are shown to improve housing stability. And then what kind of things should you be amping up or really building in or expanding in your program? So looks like the motivation building piece is the big hit there, being a little more trauma informed and using more harm reduction approaches and income assistance, which is great. We want, we know that you have a lot to do, but it's always good to be thinking about, how do you want to grow your programs? And the outreach teams, I think, have really changed in the last few years, and I think there's lots of great work out there, and great to expand those things. So just a quick, I'm going to really skim through these slides because we just want to make sure you see what's here. Documentation and other responsibilities. This is not important. This is not unimportant. It's very important. Is about clients' rights and confidentiality, making sure we get the required releases, and there's guidance on that. If you're going to put someone into HMIS, you need to have a special release for that. You probably know that, and make sure people's information is locked up. We also want to make sure people know our grievance process, your agency's grievance process. There's also a process if they're not satisfied with what happened with your agency. But start by looking at your agency's policies. So it's important to know what those policies are, so we can really protect people's information. Documentation is important. This is all the reasons it's important. For those of you who don't like documentation, you can read this slide and maybe it'll motivate you, but it really is important to funders. It's also important for properly serving clients. And I think that's the real reason that got me motivated when I was a case manager, is so other people could help this person if I weren't there. If I was taking a day off, which you all deserve days off, vacation, or God forbid there was a crisis and I had to attend to a different client, is really making sure there's some continuity of care and connection of services. So here's some administrative requirements and resources. Here's things about HMIS. I think Cheryl was the one who was concerned about data entry before. So as I said, we have some resources here. This is a link to the HMIS help desk, the training, the performance data. So here's the PATH annual report. We'll talk more about this in the supervisory sessions, because that definitely, definitely the supervisor's job to make sure that gets in. I think everybody knows this, that is on this call, that you've all been around, that being a part of the homeless point in time count hopefully you finished all your data verification. But if you didn't, because I don't think we had 100% last week, I'm just going to remind you that we need to get that outreach data corrected and verified. Shannon or Lauren is a great contact if you don't know what to do on your data. So just some key partners. There's a lot of partners in this. As we said, what's beautiful about Connecticut is this is really a collaborative effort. It takes a village to end homelessness. And this slide lists all the partners, because SAMHSA is a funder, DEMIS is a funder. You all work with the CANs. You guys are Path Outreach providers. The Department of Housing funds outreach. They fund other providers. The Coalition to End Homelessness is a big involvement, obviously, as a partner. Nutmeg really manages all the HMIS stuff. So they're a partner in Housing Innovations is us. So the following slides that come later explain everyone's roles. So if you don't know, what is SAMHSA's role? What is DEMIS's role? What are the CANs doing? What CAN am I in? If you don't know what CAN you're in, you could find out, look at the map. And then Department of Housing, as I said, these go through everybody's individual roles. So I love this picture. I just want to say we're all just walking each other home. And that's really what this is about, is helping people get a home and, you know, getting people connected with people so that we can walk that journey with them, get them to a place where they can be stable and grow and move on from their trauma of homelessness in their lives to whatever the next set of goals are, is really, really important. And do that as a team. That is using your data and your outcomes. We really have a ton of respect for what you're doing, and we wish you so much luck. But it is a lot more than luck. It's art, it's science, and it's commitment and grit. And just because we really didn't give you enough resources in the last 75 slides or whatever, we're on 76 slides. The learning never ends, and there's additional resources. Here's the link to the quarterly outreach meetings. There's monthly case conferencing going on through the summer. If you don't know how to access that, that's really helpful, where you can bring individual cases that you're struggling with. There's a lot of training resources, and they're all linked to COVID resources, and then contact information for the team if you need to reach out to us. And again, do not be shy. If you are more confused and you need help getting a handle on what we went through today, just reach out to us. We're really there for you. Okay, so we are 2 minutes to the end, which respects your time. Maybe you can have a quick bio break, but don't take too long. If you want to put your cameras on, say so long, people. Say, I see a couple of comments in the chat box. Thank you for feedback. We really I enjoyed meeting some new friends and hearing some new tricks. So thank you. Anybody want to say anything? Shout out anything? Waving goodbye.
I'll just shout out, thank you again for your time. You guys are doing great work. Keep it up, and please reach out if you have any questions.
Shannon and I are looking forward to seeing you guys all soon in the coming months. And if you've got any questions between now and then, we're always here and available for you guys.
Great.
Thank you, everyone.
This will be recorded.
Thank you.
You need to watch it or you get new staff. Cheryl, you're going to say
Oh,
something?
just thank you very much. That's all I was going to say.